Hey everybody, it's been a long time since I updated. But anyway, I realized last week that today would be my 1 year and 6 months on T, so a year and a half now. So I thought maybe I would try to make a video. Um, it's kind of hard to know what to make videos about now. Um, really, the things I deal with at this point are a little bit different. And maybe I have talked a lot in the past about lower surgery, which I am planning on doing probably next fall with Dr. Crane. I got to meet him last month at Gender Odyssey in Seattle, which was really cool. It was nice to talk with him, and I just feel really comfortable with him. So I'm about 99.9% sure I will be going with him for a metoidoplasty next fall, hopefully sometime around this time, so maybe September. So I'll be 2.5 years then on T. But yeah, so maybe then I would have a little bit more to share in videos. I'd like to share that process at least. But yeah, right now it's just more of the day-to-day living type stuff. So yeah, I'm not sure there's too much to share. Yeah, I don't really think there's any changes in the last few months. I think I made a video about 2 or 3 months ago. Um, Nothing big has happened. I don't know. I feel like maybe my face lately is I don't know. It seems a little bit fuller down here. I don't know. Could just be a haircut. I got a haircut the other day, so I don't know. It's weird things. I don't really pay attention to changes anymore as much. I am still waiting for my beard to fill out a little bit better. I'm getting a better mustache, which I let grow out a few weeks ago, but it looked kind of weird, so I shaved it off and started over again. I'm not sure I'm a big fan of the mustache, but it does kind of complete the semi-beard look I have going on. My hair is coming in a little bit better. I'm pretty much consistently get it around. It's hard to do this on camera. Get it around there and then there, but it doesn't really go up on my face. Although I get these weird, random individual hairs that kind of spot my face up like really high on my cheeks, which is weird. But yeah, otherwise, it still hasn't quite filled in some of these areas, and that just may take some more time. And the men, at least my dad's side of the family, have a hard time with facial hair, so it could be genetic too. It might not just be the T. Um, yeah, I don't know. Otherwise, oh, there is one thing I was thinking about talking about, and I don't know if this could be a separate video on its own, but I'll talk about it quick here. Um, I've I've been in I've been in therapy for 3 years now, um, and that sounds like a long time. Um, I'm not, I didn't actually even go initially for my gender specifically. I just found a therapist and started seeing her because I was really depressed, um, and had a really bad ending to a relationship, and just a lot of my friends were leaving the area. I was kind of isolated and alone, and the army was just depressing me. So I started seeing a therapist, um, and she does really intensive, long term, deep work. And so that's what I've been doing for 3 years. And I probably have another year or so left, depending on where things are at. There's no like time frame, but she tends to work with patients for 3 to 5 years. Um, it is a lot, and it's definitely a financial um, investment, I guess. But the important thing, I think, and this is something that I still have to work on with myself, is like there are patterns of behavior and patterns of things I do that I want to not do, specifically as it relates to how I relate with people. Um, and so that's kind of the reason it's taking so long. You have to undo a lot of things that took. When I started, I think I was 26, so 26 years to to build into myself. And there's a lot of things that we go through as kids that just affect us in ways that we don't realize. I hope some of this is making sense to people, but anyway, the gist of it is that I just started a new type of part, a new part in the therapy. My therapist she does a lot of work on her own and research, and so she started doing something a while back called EMDR. I think it's called eye movement desensitization, something. I don't know what that stands for exactly, but essentially it's a different way of processing past trauma. And basically we have like a target, we have a few target instances that I have in my memory that create a certain way that you react to things that are similar. Like it can be something that you can get triggered over. And so, but you have these like neural pathways that form around the way you react to these same type of stressors or triggers. And the idea with EMDR is to get you to kind of flush those pathways and reset them so you can react more from an adult, mature, more whole perspective, I guess. So yeah, so I'm working on becoming a more whole person. I guess I don't know. I'm not doing a great job of explaining this, but yeah. So I've been doing that for about a month and a half now, and it's definitely a little more intensive than the normal psychotherapy that I have been doing. Um, it's very much about getting into your mind, and the therapist sits really close to me, and she does like a finger movement that I have to follow with my eyes while I'm processing the memory. And basically she goes through sets of moving her finger back and forth for probably about 30 minutes to a second, 30 seconds to a minute. And then I'm basically sitting there silently processing the image that comes to mind, and then things start to come up, and it's been really fascinating. Um, like things come up out of my mind that I don't even realize are there sometimes. And that sounds a little silly, but it also has helped me like process things at a level that I didn't realize I could. Um, like making connections to things that haven't quite made sense to me. Um, or like why I think about things the way I do, or why I have some of the ideas I have. The biggest thing we're working on right now, and I think is something that probably a lot of trans people have a problem with or struggle with, is the thought that like I actually deserve help. And that's still something, we're not through it. I have a huge like block, and I'm really stuck on that idea that I just don't deserve the help, and like nothing that I've gone through in my life has been terrible enough to warrant like doing this kind of work, and by that I mean therapy. Um, and so yeah, it's a really tough one to struggle through. My therapist uses the word trauma a lot, and I had a hard time coming around to the idea that anything I had experienced was traumatic, except for some of the things that I went through in the army. And I worked for the military police, and I had to go see some pretty terrible things, a lot of suicides, a lot of death, really. So some of that was a little traumatic, but that would be the only thing in my mind that would be traumatic. But in her way um, in her style of therapy, like trauma is anything that affects you deeply, and it doesn't have to be like, like I think a lot of the common things are like I wasn't like beat as a child, or starved or abused or sexually molested or anything like that. To me, like those are traumas, and they're very serious, intense trauma. But even the day-to-day stuff, like something that somebody said to you as a kid that affected you really deeply and that sticks with you is a trauma. So I've had to really kind of rethink my stance on that, and I'm still not I'm still not through that part yet. And so that's what we're working on right now, specifically in my EMDR sessions, is that I do deserve help, and I do have a lot of things to get through. And what we're coming up against right now is that I just have never really had feelings, or I don't really have strong feelings. They're just so repressed because that's what I did as a kid, and it just followed me. And I guess by feelings, I mean emotions. Like, I don't really have a lot of deep impacting emotions, and I don't like having emotions. To me, they're like a weakness. So we're working on that, so I can have healthy emotional responses to things. And kind of something that goes in hand with that, probably partly being trans, is just the feeling that, like, I always feel really young. And especially with the transition, I feel like I've struggled a little bit, especially now that I'm a year and a half into the transition, with the idea that I don't. I guess I thought at this point that I would be more, feel more mature, feel more adult like, and I don't all the time. I mean, sometimes I do, but there's a lot of times I still feel really young, kind of teenagery, and just I feel like sometimes, and this is gonna sound strange. I think I saw this in somebody else's video though, but like sometimes I feel like I got dumber. Like, I'm not as smart as I was before starting T. Like, I've lost some of my mental capacity. Um, it just feels, it's just been hard. Like, I used to be a really deep thinker, I guess. I mean, I've never been like a great academic or anything, um, but I also would consider myself fairly intelligent, and I just don't feel like that. I haven't for the last year or so, and so that's been a struggle. So yeah, I think there's just a lot that I'm working around right now in therapy. So yeah, in terms of transition, that's really kind of my life. But that's not really um, just the transition, though. I think that's just life. Like, people have these things that happen to them that affect their processing of future events, and I don't know. I think everybody needs some therapy, um, and I think the stigma of therapy has to be worked on, because people just don't think they need it, and it could just help. Like, it's helpful to have an objective view from somebody that's not a friend or a family member, and just be able to talk through things with somebody is really helpful. Um, so yeah, so I guess that's my plug for therapy, and that's kind of all I really have to talk about right now. Yeah, I don't know. That could have definitely been its own separate video as I look at the time now. But yeah, anyway, so yeah, a year and a half on T, and that's about it. I am still watching other people's videos. I'm not as consistent with it lately, but I do enjoy watching other people's videos still. It's still helpful, so thanks everybody for continuing to post. I wish I could post more myself. I just don't. It's hard for me to think about what to talk about sometimes. So anyway, yeah, hope you guys are doing well. Thanks for listening.